Okay, in this station we will discuss the fourth layer of the foot, and this layer is mainly formed of what is known as the interossei muscles. Okay, when we say the interossei, then it is between two bony structures. Okay, this is the meaning of this name. And in this layer also we can see the tendons of some long muscle. And before we start to demonstrate all these structures, it is important to explain the mechanism of action of interossei muscle. Regarding the movement of the toes, in order to move either by abduction or adduction, we have to know our longitudinal axis. Okay, this movement occurs around the longitudinal axis, and the longitudinal axis of the foot, it actually passes through the second metatarsal and second toe. Okay, this is the longitudinal axis of the foot. So the interossei mainly responsible for movement of the toes. So it either moves the toes towards this axis, okay, or away from it. It either to move the big toe, for example, towards the axis, and this is called adduction of the big toe, or away from it, it is called abduction. Okay, regarding the other lateral toes, it either to move them towards the longitudinal axis, this is called adduction, or away, it is called abduction. Okay, so we have total number of seven interosseous muscle or interossei. We have 3 plantar interossei and 4 dorsal interossei. To understand the action of each, the plantar interossei mainly abduct the foot towards the longitudinal axis. So they are mainly abductors of the toes. The first or the big toe has its own abduction mechanism, which is the adductor hallucis, right? So it doesn't need any interossei on the plantar aspect. The other toes need an individual adductors, mainly for the second one, the third one, the fourth one, and the fifth one. Each has its own adductor mechanism, what is known as the plantar interossei. Okay, each one of these toe has its own plantar interossei. The second one, which is found in the axis itself, it doesn't need any adduction mechanism because it is found in the axis itself. Okay, so this is regarding the action of the plantar interossei. Regarding the dorsal one, its action mainly abduction. Okay, it abducts the toes from the longitudinal axis. So it either moves the big toe away or the other lateral, including the second one, away from its own axis. So the big toe has its own abduction mechanism, which is the abductor hallucis, right? And the small toe has its own abduction mechanism, which is the abductor digiti minimi. So we left with the other 3 toes here in the middle, the second one, third one, and fourth one. The second one, it may move from its own axis either medially or laterally. Okay, then we have 2 dorsal interossei for the second toe. One move it medially away from its own axis, and the other one move it laterally away from its own axis. The third one need to move only laterally, so it has number of 1 dorsal interosseous, and the fourth one also has number of 1. So the dorsal interossei are 4, 2 for the middle or for the second toe, 1 for the third, and 1 for the fourth. And this is very important to demonstrate and to understand before we see the interossei. Okay, so here is the plantar aspect, and we are now in the fourth layer, because we can see clearly this is the or the metatarsal bones itself. Okay, this is the metatarsal, this is the first one, This is the second metatarsal, this is the third, this is the fourth, and this is the fifth metatarsal. Okay, as they are interossei, then they take the origin from the both edges of the adjacent interossei. Okay, the adjacent metatarsal bone, sorry. So we have agreed that we have number of 3 plantar interossei, right? So this one is the first one. It takes its origin from the big toe side of the third metatarsal bone. Okay, from the big toe side. So this is the first one, this is the second one, and this is the third one. Okay, and the 3 comes from the lateral metatarsal bones and passes distally to be inserted onto the medial aspect of the base of the proximal phalanx of these toes and onto the dorsal extensor expansion. Okay, and by this, when it contracts, it moves the lateral 3 toes towards the axis, which is the second toe. Okay, the big toe has its own adduction mechanism. This is the adductor hallucis. Okay, this is the oblique head of the adductor hallucis, so it doesn't need any plantar interossei. When this contracts, it moves the big toe towards the midline, and this is the adduction mechanism of all toes. Okay, before we go to see the dorsal interossei, we have to demonstrate this tendon is the tendon of peroneus longus, traversing through the deep layer. You can see it clearly here, and it passes from the lateral aspect here. It almost grooves the lateral bone structures here and passes deep to be inserted onto the base of the medial or the medial side of the medial cuneiform and the first metatarsal, side by side with the tibialis anterior muscle. The other tendon that you can see it in this layer is this tendon, and this tendon is the tendon of tibialis posterior that passes distally to be inserted mainly into the navicular and the other cuneiform. Okay, so this is regarding the structures, tendinous structure of the long muscles and the plantar interossei. Let us see the dorsal interossei. And as you know that the dorsal interossei is a number of 4. This is the axis again. Okay, this is the axis of abduction, right? This is the axis of movement. The big toe itself, it has its own abductor mechanism. It is the abductor hallucis, so it doesn't need any dorsal interossei. And the second one may move like this from its own axis or like this. So it either move medially or laterally, and each one of these movements needs separate interossei. So this is the first dorsal interosseous muscle, this one. When it contracts, it moves the second toe, as you can see, medially. Okay, this is the first dorsal interossei. And unlike the plantar, it is a bipinnate from either edge of the metatarsal bone. Okay, the plantar is unipinnate muscle only from one side. The second one is this one. You can see it here. Okay, this is the second dorsal interossei. When it contracts, it moves the second toe laterally. Okay, this is the second one. This is the third one. Okay, it moves the third. You can see it here clearly. It moves the third toe laterally in abduction. And here we have the fourth one. Okay, here is the fourth one. It moves the fourth finger laterally. Okay, with the fourth toe laterally. The fifth one has its own abduction mechanism. Okay, it is the abductor digitomenism, so it doesn't need any dorsal interossei. It's clear. Then, in summary, this is dorsal interossei. Number of 4. They act as abductor mechanism, with the exception of the big toe and the little toe. Doesn't need any abductor mechanism. Okay, and on the plantar surface we have number of 3 for the lateral 3 toes. The second one doesn't need any abduction mechanism because it is an abductors, and the first big toe has its own abductor mechanism. It is abductor hallucis muscle, and it is commonly referred as the dorsal interossei act as pad, okay, or the dorsal as dab and the plantar as pad, okay. Pad from plantar adduct and the dorsal abduct, okay. So regarding the innervation, the fourth cleft interossei, that means the third plantar and the fourth dorsal, both supplied by the superficial branch of the lateral plantar nerve, and the all other interossei supplied by the medial plantar nerve, okay. So by this we come to the end of this station, and also we conclude our practical session here. And in this practical session we have discussed the sole of the foot and demonstrated all its layers from the first to the fourth layer, including it is tendons of the long muscles and the short muscles and neurovascular structure that can be visualized in each layer. So by this we come to the end of this module, the module of the lower limb, and this fifth practical session and the last one. And in this module we have covered the all practical sessions in 5 number of practical sessions. And at the first one we have discussed the osteology. The second one discussed the anteromedial compartment of the thigh, femoral triangle and subsartorial canal. The third one discussed the gluteal region and posterior thigh popliteal fossa. The fourth one was covered the leg and the knee joint, and this is the last one discussing the foot. And by this we conclude the lower limb module, and see you next module inshallah, and that is the end.